Hypertension is the pressure exerted by the blood, the flowing blood on the arterial wall. We all know that heart is a pump that pumps oxygenated blood to all the organs of the body. That blood goes through the arteries, called the blood vessels called the arteries. So the heart pumps at a little bit high pressure. So that pressure is felt on the walls of the arteries, and that we measure, and that is called blood pressure. So blood pressure can be measured in several areas. Can be measured in your arms, can be measured in the artery, directly into the artery, in the aorta and all, even in the heart also. So that pressure is felt on the walls of the arteries by the flowing blood is called blood pressure. So hypertension is when the blood pressure is abnormally high. It is called hypertension. So above what value we can say one is hypertensive or not. For the last 100 years, there have been very different normals has been set. So as per the current consensus, scientific consensus, any blood pressure above 120 or 80 can be considered as little bit higher blood pressure. So it is usually called, may not be called as hypertension, but it is called high normal, can be called high normal. So any blood pressure or 120 over 80 is slightly high, and it becomes pathological, or it is called hypertension only when it is above 140 over 90. The two values are there. The first value is the pressure exerted by the blood when the heart is contracting. And the second value is the pressure exerted by the blood on the artery walls when the heart is relaxing. So there is a higher value is when the heart is contracting. Lower value is when the heart is relaxing. So in most of the people, normal people, it will be 120 over 80 or below. So usually we don't set a below value. That is, it should not be below this because it depends on age. So different ages it is different. So, but any value above 120 or 80 can be called as high normal, and any value above 140 over 90 is called hypertension. It's not a single factor, multiple factors. There will be genetic factors because some people have a genetic predilection to increase blood pressure in their arteries. It usually runs in the families. So the father or mother is having hypertension. The family members, all the other members, especially sons and daughters, should check for blood pressure, check their blood pressure very frequently to see whether they are getting hypertension. So one is genetic. Second is, you can say, lifestyle. Lifestyle means depends on, one is diet. Lifestyle, there is diet is one factor. Other is whatever our stress level. Third is our exercise level. So when I come to the diet level, if you are eating a lot of processed foods, especially with a lot of salt, you can develop hypertension. If you are in a very stressful job, or if the family situation is very stressful, or if you are in a relationship in which it is very stressful, again, it can produce hypertension. Also, if you have a very sedentary habit, you can have hypertension. If you have huge, huge big weight, obesity, if you are having obesity, you may develop hypertension. So these are the factors. You can say it is genetic factors and lifestyle factors are the reasons for hypertension. There are rarely other causes. Sometimes some medicines can produce hypertension, and rarely some other conditions. There's something called a secondary hypertension, in which some tumors which produce chemicals which can increase blood pressure and also produce hypertension. And also hypertension can happen due to disease in the kidneys. A person having a very young person, maybe a child, having disease in the kidneys, like nephrotic syndrome, and then also can have hypertension. So there is a multifactorial condition. In most of the cases, it is due to genetic and lifestyle. Hypertension is always called silent killer because it can be very, very silent. Hypertension may not produce any symptoms. In a vast majority of people, hypertension do not produce any symptoms. So that is what is catch. Because you will not know, you may have very high BP for the last 10 years and you won't have any symptoms at all. If you are not checking your BP, you will miss that. And suddenly you will end up in one severe complication like a stroke or a retinal hemorrhage or a kidney failure. Then only you realize you had hypertension for the last 10 years. So the symptoms are few and only in very few people there are symptoms. But generally you can have, there are some symptoms which could be some heaviness in the head. There may be some giddiness. There may be some symptoms due to the the effect on the heart. It can produce breathlessness. So if it has an effect on the kidneys, can produce some edema or fluid retention, some ringing in the ears, like thing, can produce palpitation. That is, heart rate increases, can produce palpitation. That's all. But usually, when many people connect headache with hypertension, but most of the time, in very rare cases only, you get headache with hypertension. High BP is silent. So why you need to treat hypertension? You need to treat hypertension because of its complication. Hypertension can damage almost all organs of the body, especially it can damage your kidneys, can damage your heart, it can damage your eyes, that is the retina, can damage your blood vessels in the legs, damage the blood vessels in the brain, producing stroke, like that. So hypertension becomes dangerous because it can cause damage in almost all organs of the body. So we need to treat hypertension because of that, not because of any symptoms. So if your patient is having heaviness due to hypertension and he's taking some medicines for a month and then stopping the medicine because he thinks he's all right, that's not correct. We are treating hypertension because to prevent complications, and usually these complications happens after 10 to 20 years of high BP. It doesn't happen very fast. Only very few symptoms or very few complications happens very fast. Most of the complications of hypertension comes around 10 or 20 years after the start of hypertension. So you have to prevent this complication. To prevent this complication, that is, we are trying to treat. So I will just try to delineate what are the complications. It will come from head to foot. So in the head, you can have stroke. That's the most common thing. Can be hemorrhagic stroke or ischemic stroke. You can disable you for the whole life. So you'll be in the wheelchair, or you can also cause that. You will become unable to speak. You will become unable to see, unable to hear. All this because of stroke. The stroke is one of the most important complications of hypertension. Second is hypertensive retinal disease. So you lose your vision because of hypertension. That is very important. Third is you can also problem with the hearing again due to hypertension. For this, with the cardiac thing, you can have developed coronary artery disease, that is a heart attack, or you can also develop heart failure. Then comes kidneys. You can develop chronic kidney disease, which may lead into renal failure. That is also very common with hypertension. Then you can, the legs, you can have peripheral arterial disease in which the blood supply to the legs will become less, and your legs can ulcerate and can even result in gangrene, and you may need amputation. So all these can be produced by hypertension. Also, the many other complications are also there. Not going to the all. So the aim of our management of hypertension is to prevent complications. So you have to look out for all this. You are having a BP, and look out for all these complications and to prevent that complication. So it should not ever, that we will never reach that stage of complication. To treat your hypertension very well. You can change your life. So what are the changes we can do? One, you can reduce the intake of salt. You can reduce the intake of processed foods, like fast foods like that. Most of the fast foods may have a lot of hidden salt. We are not adding salt, but already salt is there, and we miss we don't know how much quantity of salt is. So preferably processed food, you can reduce processed food, reduce salt intake, more fresh food is better. Also better to take more fruits. Fruits will help. Plenty of water will help. And also reduce your stress level. You have to have enough sleep. So in the modern day, most people are not sleeping adequately. At least 7 to 8 hours of continuous sleep is needed. Sleep is not perfect, then you may develop hypertension. You should not have any sedentary habits. You should always exercise every day, 30 to 40 minutes. And to prevent obesity, we are already overweight, to reduce weight to a body mass index of around 25 or even less than that. So in obese people, if you can exercise and reduce your food and reduce your salt, they may be able to control hypertension without medicine. Also, patient living in a very stressful situation, try to reduce their stress by many methods. You can relaxation techniques are there. Even some psychiatric medicines can reduce your stress. Or you can change your job. If the job is very stressful, you can change your job. If you are in a relationship which is very stressful, try to change that relationship. Like that, reducing the stress will also help. So meditation, exercise will help. So these are all lifestyle changes. So all these lifestyle changes can play a good role. But still, in most of our patients, around 80-90% of patients will need medication. So blood pressure is usually managed by medication. There are several types of medications available. If one is not suiting you, you can change the medication. Only thing is you have to take the medicines regularly. So usually what we aim with a medicine is usually the control of hypertension, not the cure. We don't never claim there is cure for hypertension. Basically, control we are aiming. If you are getting a good control, that is, you can keep your blood pressure below 130 over the 85 or every time with lifestyle changes and medicines. Then the chance of getting complications are very, very, very less. So our aim is to prevent complications by controlling the blood pressure to around 130 or 85. So one question that usually arises: if you start a medicine, can you stop? That's the usual question we hear. And many people are afraid of starting the medicine because they are thinking that when once you start the medicine, you cannot stop. It's some sort of an addiction. Actually, it is not an addiction. You start a medicine, many people are able to stop or reduce the medicine. This because when patient is having a high BP, especially if it is around above 150 and 9 or above 150 over 100, you start the medicine immediately to prevent complications. That's one thing. Second, you can have time to reduce your weight, do your exercise, reduce your stress. So change in diet. All will take some time. 3 to 6 months will take time. So by 3 to 6 months, if you are reducing your weight very much, your lifestyle has completely changed. You may be able to stop the medicine. So till then, we continue the medicine. You may be able to stop the medicine. Your lifestyle becomes very big change in your lifestyle, and your BP is very, very less. Being becomes very, very less. We slowly titrate down the dosage and stop. So when if you start the medicine, you can stop. But with many people, it may not be able to stop because of lot of other factors. So one thing is genetic factors, which is very strong. All your family members have hypertension. Then we cannot change your genetic. So you may need medicines lifelong. So some people may be able to stop your medicines when after a few months to few years. Some people may not be able to stop medicine. I have seen many patients could stop the medicine if their stressful life situation has changed. Patient is in a very stressful job. They change their job. BP medicine, we may be able to stop. Patient having a very stressful family problem, somebody very sick, the spouse having cancer, so the husband is having hypertension. When it is become cured, then his blood pressure also becomes normal. So we stop the medicine. So we can stop the medicine in some people, but not in all. Large majority of them may need to continue the medicine. These medicines usually work only for 24 hours. You're taking medicine at 8 a.m. in the morning. It usually works till 8 a.m. the next day. So if you skip a dose, it will again usually increase. So you have to continue the medicine as per your doctor advice. Doctor may reduce the medicine, may titrate down the medicine as per your BP reading. So the medicine has to be continued. In many of the people, it may be lifelong. In some people, it may not be. With age, BP slowly increases in all people. All people, it slowly increases. You see a blood pressure of an 18-year-old female, it will be only around 90, 60. The same female at 35, it will be around 110, 70. And that person becomes 70, may have developed hypertension, 144, 94. Then we may have to start the medicine. So slowly there is a natural increase in blood pressure with age. So due to these reasons, we may have to continue the medicines for long. So prevention of hypertension. The person is not having hypertension, is having a genetic history of hypertension. Then you can how to prevent. One thing is reduce obesity. You have to keep your body mass index around 25 or less than that. Less processed food, very less salt. Eat lot of fresh fruits and vegetables. Try to sleep 7 to 8 hours a day. Avoid stressful situations. If a job is very stressful, just shift your job to something less stressful. Like that, you are in a very stressful family relationship or some other relationship, you avoid it or to try to get out of it. So avoid stressful relationship. Do a lot of meditations like that, and reduce your body weight and meditate, sleep well. All this can prevent development of hypertension. But still, if you are a very high genetic risk, you may still develop hypertension. But still, if you continue like this, even if you develop hypertension, it will be only mild, and with very mild dose of medicine can be controlled. So these are the tips for preventing hypertension.